When I was a nursing student, I could not for the life of me remember the difference between all of these words, and I was constantly getting them mixed up. But now it's pretty easy. So if you're a nursing student and you struggle with this, hang with me, I've got you. First of all, you need to know anatomical position. It's where the patient is facing forward and the palms are facing forward. That's going to be really important for the anterior and posterior. As a matter of fact, let's start with that pair of words. So anterior, that anti prefix comes from the Latin word. And listen, here's a little cheat code. If you can speak Latin or you understand a little bit of Latin, that's going to help you so much in learning medical terminology and decoding things that maybe you don't know what they mean, but with context and knowing your Latin prefixes and root words, you're going to have all of the answers figured out. So anti means before or in front of. So anterior is going to be anything on the front of the body. So let's say if we're talking about the anterior aspect of the hand, that's going to be this palmar surface. Posterior means after or coming after something. And this is the after part of the body. It's the back side of the body. So posterior is going to be anything on the back. So those two are pretty easy. Let's talk about superior and inferior. Super means above. So anything that's superior is going to be at higher than the inferior. And the one I think of is the vena cava, right? That's the big giant vein that returns all of our venous flow back to the right side of the heart. Our superior vena cava is above the heart. The inferior vena cava is coming up from below the heart. We also have proximal and distal. This one I think was the hardest one for me. Now, remember with proximal and distal, you're going to be focusing from the medial part of the body. Medial meaning the middle part of the body. And so if anything is proximal, that P-R-O-X comes from the Latin word proximus, which means near. So think about the word approximately. If you're telling someone it's approximately over there, you're getting them near the over there. And so like if we're talking about where we place an IV somewhere on the forearm, we have a proximal forearm, the mid forearm, and the distal. Distal comes from the root word distere, which means away from or to stand away from. Think about if something is distant, a far distance, it's really far away from you. So proximal is going to be closer to the core and distal is going to be further away. So if you are charting that the patient has a wound on the proximal thigh, proximal is going to be high up, right? That's closer to the core, whereas a distal thigh wound is going to be further down toward the distant part of the thigh. And the last pair of words are abduction versus adduction. So abduct comes from the Latin word away from. And think about it. If abnormal is away from normal, or if you're abducted by aliens, you are taken away from the earth. And we use this pair of words a lot of times when we're talking about hips post-op and we have a patient who's fractured. If we need abduction, we want the legs away from each other. So we'll use an abduction pillow. Or if we want adduction, we are adding the legs together. So abduction, far away, adduction, bringing them together. I hope that helps. Share this with a fellow nursing student.